Dr. John Tay is the director of Plantmed, which is a medical cannabis education, and also, I was going to say dispensary, but it's not. It's really a clinic, isn't it?
It's a clinic, yeah.
So, for instance, if you are interested in pursuing legal medical cannabis prescriptions, Dr. Tay's clinic is one of the places you could go to. Now, John's had a lot of experience in permaculture, organic gardening. He's very much interested in what we call the whole plant medicine. So it's really wonderful that such medical people with such a background and interest have really launched into assisting people through, I guess, often the very difficult regulations to do with medical cannabis in Australia. Thank you, John.
Thanks very much. Thanks very much. So everyone, welcome to Nimbin and the MardiGrass. And if you've heard my talks before, I'm not going to be breaking any new ground, but I am going to break it down a little more slowly. And I'd love to thank Kylie for that amazing talk, and it was rooted in some amazing facts and figures to do with studies. But I'm just going to talk in a more general sense, and I really want people just to understand how this medicine works in our bodies. So yeah, my name's Dr. John Tay, and I'm Medical Director of Plantmed Clinics in Brisbane. We've currently treated over about 3,500 people in the last few years legally with medical cannabis to great result. And a lot of people in Australia still think cannabis is illegal, and thanks to great events like this one, times are changing, and this plant's getting more access to people. So that's okay. You can all see the slides there. So not yet? No. So they'll be coming in a second. This next slide just says THC and CBD on it, so that's basically what it says. They're the two main molecules in the cannabis plant. THC, tetrahydrocannabinol, and CBD, cannabidiol. So, as if you've heard already today, there's actually a large entourage or suite of molecules besides those two, but they're definitely the most prominent ones. So THC, it's the bit that gets you high. It's the bit that can give you that euphoric effect. And as Dr. Kylie was mentioning, we get those effects as THC binds into those areas of our brain that make us happy and release chemicals like serotonin and dopamine so we feel happy. THC is the main cannabinoid, and it's used throughout the body. The endocannabinoid system is something that I'm going to talk about a lot today. THC stimulates that system. It actually binds into the cannabis receptors, and depending on where they are, we can have lots of different effects from that THC. So THC is great for appetite. THC is great for helping you sleep. THC is excellent for relieving chronic pain or long-term pain. No good if you cut yourself, no good if you have a surgery, but pain that keeps on going after that initial injury, that's chronic pain, great for that. So fibromyalgia, osteoarthritis, rheumatoid arthritis, many, many reasons we can have pain, migraines, headaches, okay, ulcerative colitis and gastrointestinal issues. So pain is definitely one of the main things that I personally treat in my experience in the clinic. Over 60% of patients would have some element of pain. They may have other components as well. The other main component is CBD. And CBD's had a lot of great press in the last few years, and that's a little picture of what it actually looks like. CBD is the second most common cannabinoid, and over the years, because of prohibition really, we've bred out the CBD out of the plants because over the last 50 to 60 years, people wanted THC for recreational use. They wanted THC to feel happy or get that euphoric or high effect. So because it was illegal for so long, the CBD was bred out. Like tomatoes, we only wanted the red ones, we bred out the green and the yellow ones, and we kept the red ones. So in the last few years, CBD has gained a lot of popularity. And so CBD has been bred back into our cannabis plants now so we can use them as a medicine. And as Kylie mentioned as well, there's lots and lots and lots of varieties. The correct word for variety or strain is chemovar. That's one we use in cannabis medicine, of cannabis plants. And they have varying levels of all of these different molecules in them, CBD and THC, the main ones. CBD is a great anxiolytic, so anxiety relieving medication, as Kylie pointed out with her focus on the brain. It's also a great anti-inflammatory medication, so it works all throughout our bodies to reduce inflammation at the cellular level, reducing the flow of those compounds which Kylie once again mentioned called cytokines, which trigger and make inflammation happen and then stop again. So CBD is a really important molecule. And one of the most important things I think I use CBD in my practice for is to balance out THC. So THC on its own can be a little problematic in my opinion. It can make you a little nervous, as we noticed from the studies that Kylie had at the end of her talk. So if you have THC alone, and you might have done it yourself, you've been at a party but you don't really normally take cannabis, but you've had a couple of drinks and you think, I'll just have a little toke on that joint that Cheryl's passing by, and you might have a little bit of that joint and suddenly get very nervous or very anxious. And that's because usually, because of the way we bred our plants, there's CBD absent out of that cannabis. So that straight THC can be anxiety causing, okay? And in extreme cases can be paranoia. So CBD offsets, importantly, the side effects of cannabis, especially the mental ones, especially that anxiety and the high feeling. So it kind of changes that high you would get if you just had pure THC. And I was actually in reading yesterday to touch up for my talks this weekend, I did come across a study that mentioned the chances of paranoia or anxiety being caused depending on how much THC and lack of CBD you were taking was very interesting. So it found that if you had 5 milligrams of pure THC on its own, you are much more likely to get anxious than if you had CBD involved. And if you had adequate amount of CBD, I can't remember the exact numbers, but I think it was about 1:1, 1 part CBD is to 1 part THC. You could then actually take more THC before you got anxious or even paranoid, and it was actually up to 48 milligrams. So that's really important when you're using this as a medicine, not just as a recreation. And that is a blurred line, I must admit, but it is important when definitely using it as a medication. In my books, CBD is very, very important for tolerating and allowing us to get that dose high enough so that we can actually get a clinical effect. And THCA, so there's a little bit of talk about THCA this morning, and there's A's for everything. There's CBDA, CBNA, CBVA, and all the A means, it means it's raw, okay? So if you juice a cannabis plant and you drink it, you're gonna get raw cannabinoids. They have got beneficial properties for you, but you're not gonna get high. You could eat a whole cannabis plant, which is high in THC, and if you just ate it, you wouldn't get high at all. And there's an important thing that creates that or activates our cannabis. And at least in the legal market in Australia, all of the medications we have are either activated or you activate them yourself by adding heat. And that's the process of decarboxylation that Kylie also mentioned earlier. So decarboxylation means you add heat, you add energy to that plant, those molecules, it flicks off a little bit of one of them, and then it's the same shape as our anandamide, and that's how it works. So as soon as you add heat via smoking, vaporization, or in the process of making a medicine, you decarboxylate or activate your THC and CBD, and then the THC in particular can bind directly into those cannabis receptors. If it hasn't been heated up or activated, there's a little bit sticking out the side that stops it getting into those receptor clefts, and so it won't work as activated THC does. So THCA, or the raw form, is very good. It's got lots of health benefits. It's anti-inflammatory. It's generally good for you. It's actually very good for your gut as well, but it's not going to get you high. So that's an important thing to know. And strain or chemovar, which we mentioned before. We breed plants. We have as humans for our whole life. And we breed and we spend a lot of energy over the generations on this cannabis plant, to the point now where there's tens of thousands of different strains or chemovars of cannabis plant. And some make you happy, and some make you sleepy, and some make you hungry, and some are great for pain. And that all depends on the terpenes and the entourage effect that we've been talking about today. So all the mix of those different chemicals, and they can be all varied in different plants or strains, provide different, slightly therapeutic effects. Okay, so strain is really important. Sativa and indica aren't strains. Now, if anyone, I'm sure everyone here has heard of these two different types of cannabis before. Sativa plants grow outside. They're tall, like the one on the right there, usually skinny. They grow outdoors in the sun, they take up more room. And they're generally high in characteristic terpenes. So pinene is one of those, limonene. So pine trees and lemon, we associate them with being energized, activated. We have them in the morning. When we walk through that pine forest, we feel energized. And so that's basically what a sativa-based flower is. The two main types are sativa and indica. Sativa flowers will not put you to sleep. They will perhaps even energize you. They're still very good for pain, they're still good for appetite, but we should really only use sativa-dominant or pure sativa-based medications during the daytime so that we don't disrupt our sleep patterns. Indica-based medications are more sleepy. They're helpful to get to sleep and stay to sleep. They're very muscle relaxing, so they're good for stress, they're good for anxiety, and they're good for pain. Often pain is associated with muscular tension. And cannabis really relaxes all of us, all parts of us. It relaxes us in our mind, as Professor Kiley has pointed out so eloquently for us. It relaxes our muscles, the voluntary muscles that we associate with tension, our neck, our back. But it also relaxes our internal bits. It relaxes our blood vessels. So it means that our blood pressure may drop slightly and our blood flow will get to the edges of our bodies better. It relaxes the tubes or the bronchi in our lungs. So used correctly, we can actually use that to help with things like asthma or COPD, diseases of the lung, which we wouldn't normally associate with using cannabis. But that's more to do with the smoking. So we don't recommend smoking as a medical professional. And the entourage effect. The sum of the parts is greater than the whole. I think that's the right way around. In the cannabis plant, there's actually over 144 cannabinoids thus far discovered and isolated. THC and CBD are the big ones, and a whole bunch underneath that. There's over 300 plus terpenes being discovered in the cannabis plant, which is amazing variety. Terpenes are the chemicals in the cannabis plant and the chemicals in roses and fruit of all varieties that gives us an aroma, the nice smell. So if we took the terpenes out of some cannabis flower and gave it to you to smell, it wouldn't have an amazing smell. Smell like, just a bit of grass or a bit of leaf. But when we add the terpenes in, that's where we get the smells of citrus. It's where we get the smells of mango. It's where we get the smells of pepper. The reason being, all of these terpenes are inside that plant in varying numbers. So terpenes give plants smells and they have activity in our body and they work together with CBD and THC. They change the way THC may bind in a very small way to certain receptors in our body. So terpenes are a really important component, and that's what gives the individualization or the specificity to cannabis as a herbal medicine, as a plant medicine. We tailor it to each person's individual needs, and if you have an idea of what's inside of those medications or those buds or flowers, then you can choose something that's going to match a patient well, or you can choose a plant which is going to match you well if you were to grow it or obtain it somehow. So linalool is the terpene from lavender. It makes you calm. Okay, so we know that. Everyone's familiar with that. Myrcene is the smell of mangoes. And an interesting thing about myrcene and mangoes is that myrcene can actually increase the pain relieving and psychoactive effects of THC and the muscle relaxation effects of THC. So myrcene can actually increase your high or increase the effect of your medication. So we can have a mango with our medicine and that will actually help out. But myrcene is found in a lot of the indica varieties of cannabis because it's relaxing. It's associated with what's called couch lock, or that relaxation and that muscle relaxation that lets you lean back in your couch and sink right into it. Okay, so it's a great and important terpene to know about. Another really important terpene is beta-caryophyllene. It's my personal favourite terpene, if you can have a favourite terpene. I know that's a little weird, but beta-caryophyllene is also found in hops and black pepper. And what it does is we ingest it, we either inhale it or we eat it or we can rub it on, or even go through our skin. And it travels through our blood until it finds a cannabis 2 receptor, specifically cannabis 2. It's a very specific terpene. And it binds to that receptor in a similar way that CBD does. So a lot of essential oil companies will market caryophyllene or copaiba oil as natural, legal CBD. And in a way, I suppose it is, because it binds to the side of those CB2 receptors and it increases how strong their fingers are. And those CB2 receptors are found on all our inflammatory and our immune cells. And so it helps down-regulate inflammation in our bodies. It works together with our THC and CBD. So we can add that as an essential oil orally, or it's found naturally in our cannabis flowers that are good for those pain-relieving qualities. So terpenes are a really important component that goes to that entourage effect, and there's a little picture of all those varieties of terpenes. So they are very important. So for instance, we wouldn't choose a sativa flower generally for someone who's very anxious, because we could actually increase their anxiety and increase their awakeness if they can't sleep at night. So we'd probably choose a more muscle relaxing and more relaxing type of indica flower. And you can also get combinations of both. So the endocannabinoid system, and this is, you've already heard about it with every talk, and I'm sure you're going to hear about it in every other talk on this stage in the medical part of the symposium, because we've all got one. The endocannabinoid system is a system that runs throughout our whole body. Focused, yes, mainly in the brain, the spine, and the nervous tissues, but also peripherally associated with our immune cells and our inflammatory cells, especially associated with our gut and skin, which are the areas, the layers which separate us from the outside world. So it's a very important immune barrier. So there's a very strong immune connection with the endocannabinoid system. So the THC molecule itself was discovered in 1964, or isolated. We knew it existed, but it was isolated in 1964 by Professor Raphael Mechoulam. He's an Israeli professor he's still here with us. He's about 90 these days, I think. I think he's actually scheduled to talk at a conference in Australia later this year. But he discovered THC. And then quickly after that, in the late 80s, early 90s, we discovered the cannabis 1 receptor. And then in 1992, we discovered the endocannabinoid system. Cannabis works because we have an endocannabinoid system. We've all got one, all of us. Every animal on the planet has one, except the insect species, but all other animals have an endocannabinoid system. In our endocannabinoid system, we have the main molecule is anandamide. So that's the one that THC copies, okay? Anandamide means bliss. It means happiness from the Sanskrit word. So it's a description of what THC does. It gives us happiness. It's one of the main things people use cannabis for. And the other main cannabinoid is 2-arachidonyl glycerol, or 2-AG. So both of those molecules are mimicked by the plant THC molecule. That's the reason they work. We add the plant molecule and it tickles the receptors which we've already got naturally in our bodies. Why do we have an endocannabinoid system? Why would we need one? Well, we need it for everything. And when I say everything, I mean literally everything. It's a homeostatic system, or a system of balance. In our bodies, we need to balance the amount of water that's there. We need to pee out some. We need to absorb more or not pee out some if we're thirsty. We need to balance our emotions. We need to balance the amount of chemicals that make us go to sleep and stay awake. We need to balance the way that our gut moves. So every component, every system of our bodies is coordinated by the endocannabinoid system. It's the head regulation system, and I really mean everything. So that's menstruation, that's menopause, that's directing our growth from birth until we die. That's directing the inflammation in our bodies. It's literally everything. So it's amazing that we've only rediscovered this system so recently, but it's also amazing that we have, because now we can think about how to use it properly. The endocannabinoid system, it's kind of hard to imagine, but it's there from birth. As soon as those first two cells come together, our endocannabinoid system starts to form, and it directs us as we're growing in our mother, and then at birth we get a massive release of endocannabinoids into the breast milk for that first feed, and then from that point on, the endocannabinoids are priming that little child's immune system and directing his growth all the way through till he dies or she dies. So their whole life is directed by the endocannabinoid system. So we want to make sure it's healthy. And that's what I do as a medical practitioner. I don't just sign a form that gets you legal cannabis so you don't get a speeding ticket. I try to maximize your endocannabinoid system. I want it to be as strong as possible, because theoretically, if we can boost that system, you don't need any cannabinoids from the outside. It's very hard to achieve that in our world and with the stresses and strains of pollution and stress in our bodies. But we can approach that, and the more we support that system, the less cannabis we need from the outside. So it's associated with the suckle response, it's associated with release of oxytocin, or the happy chemicals that make us protect and love and nurture our children. It's there from the beginning of our first cells joining all the way through as we grow. The endocannabinoid system, it's not a system of tubes or pulleys or nerves. It's not connected together even. It's everywhere. So there's two main types of cannabis receptors, but once again, like the cannabinoids, there's heaps and heaps of other ones, minor ones that aren't called cannabinoid receptors but are kind of considered they are, like the serotonin or happy 5-HT1A receptors associated with release of serotonin and happiness. That's one of the main ways that antidepressant medications work. Conventional antidepressant medications is to keep that serotonin level high. So cannabinoid receptors, CB1 receptors in particular, are situated throughout our brain, down our spine, and peripherally as well, in the skin, but mainly centrally. Cannabis 2 receptors are associated with inflammation and immune response. So they're found more peripherally. They're found in our lymph nodes, they're found in the skin and in the gut lining, they're found on all the inflammatory cells, the macrophages and other white blood cells, they're found in our bone marrow and spleen. So there's two main types of receptors, and they're both stimulated by THC or anandamide. And there's a lot of them. In the brain, a lot of receptors are called G protein receptors. It's just the way we describe how they're made. They're made out of proteins. And they cross the cell membrane. And in our bodies, in our brains, there's 10 times more endocannabinoid receptors expressed than there are G protein opiate receptors. So everyone knows about opiates: Panadine, Fort, Endone, morphine, heroin. They numb down pain, and they do that quite well. And we use that a lot in our society. But in fact, the endocannabinoid system has got more receptors than that. And in regards to pain, the endocannabinoid system is intimately linked with all of our pain systems. It slows down pain at the level of the spine, so that's why we feel less in our head, and it slows down how we perceive pain in our head. So you might still have a sore knee, but it doesn't get to your head, so the pain's gone, or at least you can get around on your day. So found throughout the brain. CB2 receptors peripherally, but also in the brain, associated with those microglia cells that Kylie was telling us about. And the inflammation in the brain is regulated once again by the endocannabinoid system. And that's just a picture of the G protein receptors that are our cannabis receptors. So people always ask me this. It's like, oh, how does this system really work? I don't really understand it. Is it connected by tubes or electricity or none of those things? Cannabis receptors can pop in and pop out of any cell in our body whenever we need them. Okay, and that's called on demand. They're exuded on demand, or they're involuted when we don't need any stimulation in that area. So if we were to think about, say, someone with temporal lobe epilepsy, that's epilepsy in the side of their head here, if we looked at how many receptors there, we'd find lots of receptors, CB2 receptors associated with the inflammatory cells, and CB1 receptors associated with that area of the brain, the neurons, that Normally we would have an electrical impulse that would start in the back of our brain and move along, and it would start to get too big and we'd turn it down, and we'd turn it down with our cannabis receptors. So we pop out a receptor, and then we quickly generate a bit of endocannabinoid, some anandamide, that stimulates that receptor and turns that nerve down. That's a pretty broad way of saying it, but it turns things down. But in epilepsy, we can't turn it down. It just keeps going up. When we express the receptors, but maybe we can't produce enough anandamide maybe to do it, or for whatever reason, we can't stimulate those receptors effectively. So that's epilepsy. Similarly with PTSD, we have dopamine production in the middle of our brain in the basal ganglia that stops us actually tremoring and shaking. And if we don't have enough of that, we start to get Parkinson's disease. So we see when we look where the receptors are expressed in Parkinson's disease, surprise, surprise, they're all in those basal ganglia areas, the areas which produce our dopamine. So we can see here that we have got a central predominance of CB1 receptors and a lateral or outside predominance of CB2 receptors. So if you have a sore knee, I'll just elaborate a bit more. If you have a sore knee, perhaps you'd have a lot of receptors around the nerves and the inflammatory cells of that knee, which we'd notice, and that's your body saying, hey, come over here, I got a sore knee, I need to turn down this inflammation, I need to get things fixed up so I can get on with things. And that's keeping that balance, okay? So we can pop out a receptor anywhere, and it depends on you and it depends on your body where they'll be expressed. And that's why cannabis medicine is so amazing to me, because I could be treating you for a headache and get a great result on your hunger or your sleep. It's a multi-system treatment. The endocannabinoid system is multi-system, and it integrates with all of our other body systems, and it's the main one, okay? And here we go, there's a slide just showing all those areas that cannabis receptors are seen as being a lot of. So in the brain, in the lungs, we've got bronchodilators that opens your lungs up. In your liver, we've got controls fibrosis and fat production in the liver, so it's important for protection against things like alcoholic liver disease or just aging liver. In the bones, CB2 receptors are associated with remodeling of our bones, so CB2, although it won't probably increase your bone density, it may slow down how much it's getting resorbed or weakened if things like osteoporosis, okay? It's found in our muscles. Throughout our vascular system, we get that relaxing and the dilation so our blood pressure can drop and we can be more relaxed. In our spleen, once again, a massive organ of immune function. The pancreas, insulin secretion. In the colon, gastrointestinal motility and a very important role in the immune system of our colon, in our reproductive organs. So throughout our body, we have this endocannabinoid system. And so when we express a receptor, we then create some anandamide or some 2-AG to stimulate that receptor, and that will then turn down the neuron beforehand. So that's that complicated retrograde inhibition system. So all it means is cannabis turns down whatever system it's connecting to, whichever system is expressing those receptors. And this is a little complicated, but I want you to try and understand. So if we're talking about our adrenaline system and our fight or flight system, okay? We're getting panicky for no reason. We've got anxiety. My heart's starting to race. Okay, I know that no one's trying to attack me. I'll just turn that down. That's what normally happens in us. But in someone with anxiety, they can't turn it down. So what should happen is we express the cannabis receptors, we secrete our natural cannabinoids, and that will turn down the adrenaline system. The adrenaline system makes you go faster, it makes you run. So when we turn down that system, we get a relaxation. But the opposite can happen. if we've got the GABAergic system or the dopamine systems, they're systems which generally slow us down. So if we stimulate that system, it will actually speed us up or release the inhibition. And that one works really importantly on that pain pathway I was just mentioning. So in the back of our spine, in an area called the periaqueductal gray, a little bit on the back of our spine, we have a GABA interneuron, it's called, so a little set of nerves that go across. And what they do, they're a GABA system, so they're constantly suppressing any signals. And they suppress our pain suppression signal. So in chronic pain, normally we would turn on that system so that the pain goes away and we know we're not in pain anymore, we just turn it down until it's fixed, we'll be okay. But when we can't turn that down, that's called chronic pain. So we take some cannabinoids, we inhale them or we ingest them, THC in particular, and they go into our body, they connect into that GABA connection at the back of our spine, and then that turns off the inhibition. So that sends the signal back down our body and starts the pain suppression pathway. So THC, it really does work for pain. And anyone that says it doesn't is wrong. But I must say only chronic pain. So acute pain is not helped by cannabis. If you break your arm or you cut yourself or you just had surgery, you're going to be safe. It really is an important thing. This little diagram here is just showing you at the base of our head, below our brain and our brainstem, there's a little part of our brainstem that controls respiratory rate and heart rate, okay? And there's no cannabis receptors there. So it doesn't matter how much THC you put into your body or how much anandamide your body secretes, there's no cannabis receptors there. So that has no effect on breathing and respiration. So you can have as much cannabis as you like and you can't kill yourself from cannabis alone. There's a funny little story about the only way you can really kill yourself with cannabis is if you load up a pallet of cannabis and drop it on your head. And it really is almost true. The amount of cannabis you'd have to consume to potentially kill yourself is impossible in one sitting. It's just not possible. So cannabis is extremely, extremely safe. And that's very different to our other main painkiller in this society, opiates. So opiates can actually turn down this part of the brainstem, and that's a problem in our society. We've got a lot of people accidentally dying from opiates because they're addictive, and you always need a little bit more to get the same bit of pain relief. And one day you'll just have that little bit too much, and it'll overstimulate this part of your brainstem, and just your heart will just stop. And that's an overdose from opiates. And that's something which cannabis is helping to reduce in our society, you know. It's really common to see people reduce, if not remove, their opiates from their pain relief program once they've got an adequate cannabis program in place. And there's a little bit more to it than just having a joint, I must say. So the endocannabinoid system, it's widely distributed. We've all got one. It's been there since just as soon as we were conceived, and it's going to be there till after we die, and it regulates everything in our body. And that's how our medicine works. That's how cannabis medicine works in our body. So we've got to think about that, and we've got to feed that system. So how do we feed that system? Well, we can feed it with plant cannabinoids. That's, of course, we can ingest THC and CBD and support that system. The THC is going to stimulate wherever those receptors are being put out in our body. So even if we can't make enough of our own endocannabinoids, we'll still tickle those receptors and they'll turn the key and start whatever process needs to be started there. But there's other ways. And we alluded to it before. One of the most important ways, from Dr. Catalardis brought it up as a question at the back there in the last session, is to feed this endocannabinoid system. What's the fuel? The fuel is omega-3 oils, okay, in a very broad sense. So where's our best source of omega-3 oils? The best source of omega-3 oils is through fish or krill oils, okay? They're called what are called long-chain fatty acids. That's just what's in fish oils, okay? And those long-chain fatty acids, when we eat them, they're incorporated into our body. We store them. And they're incorporated specifically in all of our cell membranes. So every lining of every cell is made up of fats and little tails, hydrophilic or water-liking tails. So that's what makes the membrane up. And when we eat these omega-3s, another great source of omega-3s is, of course, hemp seed oil, which is a plant-based type of omega-3. The difference between hemp seed oil and fish oils is the length of the chain. That's all. So if we eat plant-based oils, we need a little bit more volume of them, but then in our body, they're converted from short-chain fatty acids to long-chain fatty acids, EPA and DHA, okay? And then they go into our cell membranes. And from our cell membranes, they're just stored, okay? And that's great for heart and cardiovascular health. It makes the inside of our blood vessels smoother. That's why they say everyone should have, some fish oils to help with their heart health. They're a bit anti-inflammatory on their own. But those omega-3 oils, which are put into our cell membranes, are used to make on demand. So when we express a cannabis receptor, there's a little demand that says, hey, we need a bit of something to stimulate the receptor, make me some anandamide, and it flows and connects it, okay? So that anandamide is made out of the cell membranes, which are made out of omega-3s. So it's very true that we should eat a lot of omega-3s, and in our Western world, we are very deficient in omega-3s. It's way down here, and it should be about up here, okay? So the easy way to fix that is just have some fish oils, or if you don't like fish, have some hemp seed oil or some flaxseed oil and add some more chia seeds into your diet. And if we do that regularly, we'll have enough stocks in our body so that we can make as many endocannabinoids as we can. And the other really important thing is those fats are also the things that make up the cannabis receptors. So if we're deficient in omega-3s, then our cannabis receptors don't form quite right, and they got weak fingers, sort of, and they can't hold on to our anandamide or our THC as well as if we had enough of these omega-3s. So that's a really big one. Eat some omega-3s, eat some fish oils, eat some hemp seed oil, but eat it every day. As you increase that over time, you're going to make sure that you're maximised. You're maximised in terms of endocannabinoid function. There's also other compounds, plants and things we can do to increase our endocannabinoid level in our body. Curcumin or turmeric is a great way. It's a great anti-inflammatory. Everyone sort of realises that. But they may not realise that it also has this anti-inflammatory effect through our endocannabinoid system. And when you take turmeric regularly, it will upregulate and increase the amount of endocannabinoids you can produce in your body. Other essential oils like the copaiba oil or the beta-caryophyllene terpene oils, a great way to add support to the endocannabinoid system. Things like copal incense, which is a specialised type of incense from India, I believe, I've never actually smelled it, is known to increase your endocannabinoid production. Okay, black pepper is known to increase your endocannabinoid production. Reducing stress. So stress in our bodies is cortisol and adrenaline. Cortisol mobilises blood sugars, and there's a lot of de-inflammation we need to do to turn down that inflammatory damage. And that turning down of the inflammation is once again the job of the endocannabinoid system. So if we de-stress our lives, it's one job the endocannabinoid doesn't need to do all the time. And at the same time, it's a double whammy in a good way, is that when we use cannabis and cannabis medicines, we are de-stressing, as we've mentioned today. So cannabis will reduce your stress, reduce your cortisol, therefore reduce your adrenaline, therefore reduce your mobilization of blood sugars in your body, because your body's getting ready to fight or fly. And by doing that, we're reducing the stress on your whole endocannabinoid system, and it can function better. So we've got to look after it. One of the big things that was also mentioned by Kylie was that gut health component. And yes, there is a really strong link between gut health and mental health and the endocannabinoid system. So we want to make sure that our gut is healthy, that the probiotics are there, and they can do their job of making our brain chemicals and protecting our gut against damage and keeping those junctions between the cells of our gut tight so they don't leak in inflammation into our body. When we eat chemicals that are disruptive to the probiotics, like antibiotics, excellent way to kill your probiotic system, okay? Herbicides and pesticides in our food, so eating a clean diet is important, free of chemicals in our diet. We want to keep that healthy probiotic or gut system as healthy as possible, so adding in probiotics and cleaning up the diet's another amazing way that has been shown to increase your natural endocannabinoid levels. Even simple things like exercise increase your endocannabinoid levels. The endorphin rush that people get addicted to with exercise, I wish I was addicted to it, but that is associated intimately with the endocannabinoid system as well. So we've got to look after that system, and it's the system which our medicine works in. I'll just go back to that slide. So this is a picture of a lovely gentleman who I've had the honour of meeting, Dr. Ethan Russo, and he's one of the leading cannabis doctors in the States and worldwide. He He developed the first full plant pharmaceutical cannabis medicine really in the world. A lot of studies were done on using that initially because it was the first one out really, called Sativex. And that's still available today. It's maybe a little bit expensive, but it's still around. And Dr. Russo noticed in the course of his work and his studies that a certain group of diseases were all associated with lower than normal circulating levels of endocannabinoids, so anandamide and 2-AG essentially. And he called this clinical endocannabinoid deficiency. So that's not a disease. It's just it's an association again, okay? So it's not the cause or the reason, but there's a definite association that people had lower than normal levels of their own natural cannabinoids. We're in this list of diseases, and it's a pretty broad list, as you can see. So anorexia, motion sickness, fibromyalgia, Huntington's disease, it's a neurological disease, inflammatory bowel disease, menstrual problems like endometriosis and adenomyosis, migraine, multiple sclerosis, Parkinson's, PTSD, even schizophrenia and mood disorders, depression. So we noticed this correlation between these seemingly totally different diseases. And it's something which I've seen replicated in my practice as people will come in and it's just almost like they've just come straight out of this textbook. It's like, yep, I've got endometriosis, migraines and inflammatory bowel disease, and I've got a little bit of psoriasis. I'm like, bang, endocannabinoid deficiency. And really, we've all got that in varying amounts, okay? So when we're born, when we're 20, our endocannabinoid system's, it's up there. It's going as good as it can. We're fine. We don't get sick. We're healthy. And then you probably notice somewhere about 30 to 40 years, your feet get sore. You get a little achy on the back. You start to age. And this aging and this reduction, increase of symptoms, say, increase of illness, is because could be because our circulating endocannabinoids are a bit low. So we want to boost that. And we can boost that nutritionally, as I've mentioned, and of course we can boost that with THC and CBD. So that brings me to whole plant medicine, and I'm not sure how much time we've got left. If I finish early, we can just have a chat and I can answer some questions. But whole plant medicine is something that's very important to me. And there's actually a panel on tomorrow evening. If any of you are interested, I highly recommend to come and listen to that. Based on what's better, an isolated compound, CBD or THC, or a full spectrum or a non-isolated compound. So because we can take CBD out and THC out and just have a pile of those molecules, just that. It's just like a white crystal. So we can do that, and we can treat people with it, and then we can compare it to as if we treated them with whole plant medicine. And the evidence is being gathered for it. There needs to be a lot more studies done on it, and that's going to be the conversation we'll have tomorrow. But it seems to be that if you use a whole plant medicine, those terpenes, those flavonoids, those other minor cannabinoids, they all work together in that entourage effect to have that greater result on relieving pain and symptoms, anxiety, whatever we may be causing. So it's important, I believe, to choose a whole plant medicine where appropriate, which is generally appropriate, unless there's a specific reason why you wouldn't want to include that. And that is, some people have specific reasons for driving. They may be a bus driver and they just can't even have the smallest amount of THC. So we have to take into every patient's consideration their personal position. But generally, I find whole plant medicines are better. And a whole plant medicine means we just extract everything from the plant. We take the CBD, the THC, the terpenes, the flavonoids, and extract that and put it into an oil. And that's your medicine, okay? So a whole plant medicine, or of course, a bud or a flower is a whole plant medicine. So I think I won't get into how we treat certain specific diseases. We can just know that we have an endocannabinoid system, and that's how our medicine works in us. And we can ameliorate, we can get rid of those signs and symptoms, and sometimes even reverse diseases. And in this sort of conversation, we haven't got enough time to get into the specifics. But I think the take-home messages are, look after yourself, look after your body, look after your diet, look after your endocannabinoid system, because that's what directs you from your birth to your grave. Okay? Feed it well, don't hurt it. Supplement it where possible, where necessary, with cannabis medicines. And cannabis medicines generally de-stress our lives and de-stress our body, which results in less disease and less pain. So I'm going to open up the floor in a minute to any questions while we have a little bit of time left. But I do want to let you know that if you go over to the far side of the festival, just past the chai tent, over that way, right to the edge, you'll see the Plantmed banner up there. I've got a little stall where you can get more information. I've got my staff there handing out referral booklets and information about people who are interested in accessing medicinal cannabis legally in Australia. And it is legal. That's the big thing. And that's why we're celebrating here today, because it is legal. And it's probably going to be recreationally legalised within the decade or so. That's my guess. But it is legal now, and we can access it, and we can use it as medicine. So please come and visit us at the stall and get some information if you're at all interested. We're also running, as part of that stall, the Cannabis Broadcasting Network. So we've got a couple of roving cameras, and one of my practice manager, actually, Chloe, is the reporter around MardiGrass, and we're capturing footage of people and interviews. But if anyone wants to come over and give us a couple of minutes of their time, we've got a little setup over there where we can just record your 2 minutes. And simple questions like, how did cannabis first start for you? How has it helped you in your life? And we're just recording that footage for use in a documentary on Mardi Gras. So please come and put in your 2 cents worth. But I hope that's been informative, and I'll open up the floor to any questions, which I love answering.
Yes, and our mic runners are ready for your... Please put your hand up if you're interested in asking a question, and we'll come over to you. Here we go.
Dr. Tay, Robert V from Brisbane. Just some practice experience. Do you start off with a high dosage and then reduce as it comes under control? And what's the advantage of having some sustained medicine going forward?
Now that is an excellent question. Thank you, Robert. We don't start with a high dose. If we were to start with a high dose of THC in particular, we're going to most likely get those side effects that may come with cannabis, things like anxiety or paranoia, dry eyes, red mouth, low blood pressure, feeling a bit wobbly, feeling very sleepy. So we do need to tolerate to cannabis medicines. Now, CBD is not something we necessarily need to tolerate with. So normally what I would do is have a baseline of CBD, say twice or 3 times a day for a patient. So we know that's always in there, and we don't need to get used to it because there's no high effect. Then we add in THC very slowly, and it depends on whether you've used THC or not. If you've been smoking cannabis for 30 years, we'll obviously go a bit quicker. But if you're completely new or naive to cannabis medicines, we'll start with essentially 1 milligram or 2 milligrams of THC. And then in my practice, I'll give you a little sheet with weekly increases. So we keep the CBD steady, and we increase that THC, and I'll get people to keep a little diary until we've got rid of their pain or we can see it start to reduce. So that's called titration. So we'll start with a small amount of THC and build that up till we get the effect that we're looking for and not too many side effects, and that's our dose. If we rush that process or we don't do that process, then we are more likely to have negative effects from cannabis, and cannabis medicine is a potent medicine. So we don't want people to feel uncomfortable. We don't want people to be more anxious when they are trying to reduce their anxiety. So tolerance to THC in particular is very important. And regularity of dosing is very important too. So we wouldn't as a medicine, it's important to be consistent with your medications. In all medications, if you've got a heart problem, you take that pill every day to keep your heart and blood pressure down or your cholesterol down. Same, and probably more importantly with cannabis, we must be consistent. CBD in particular, because it doesn't have a direct stimulation effect on our cannabis system, we need to have that there all the time. And in fact, it takes 2 to 3 weeks before you'll even notice an effect from CBD alone in your body. And similarly with THC, we want to build that dose up slowly, and we don't want to chop and stop and start, because when you stop and start, you'll actually lose tolerance. And if we lose tolerance, it means you're going to get the high feeling too quick before we get control of your pain. So we use tolerance to THC as an important thing so that we can actually get the dose high enough to fix your problem. So there's no point stopping and starting. Consistency is the key. So thank you. Very, very good question.
Yes, hello. Just got a question, sort of specifics about mast cell disease, histamine reactions, anaphylactic shock. What, like that? Okay, sorry. Did you hear that?
Yes.
The anaphylactic shock. And also any tips on using CBD for menopause, all the menopausal symptoms?
Okay, so I don't know that there's a whole... Well, CBD itself for menopause, I'll go backwards there. CBD will support the endocannabinoid system, which is going to support the regulation of your menstruation or anyone's menstruation. So making sure that system is in top order is probably a good idea to slow down the harsh effects of menopause, to make that transition easy. In terms of mast cells and histamine release and anaphylaxis, CBD, once again, is a very, very good anti-inflammatory molecule. It's probably not something we'd use in the case of acute anaphylaxis, because in that sort of situation, you know, you can have your throat can close up and you can't breathe and you can, you know, asphyxiate. So in those sort of acute situations, we would definitely need to utilise, you know, adrenaline shots and that sort of thing. And maybe even intubate a patient if they've got anaphylaxis. But to reduce inflammation throughout your body, I think regular CBD use would be a very good idea. And in terms of particularly inflammation to the brain and damage to the brain, it is known that CBD administered very soon after a big head knock or brain injury helps reduce any ongoing damage in the brain, so it's neuroprotective, and they use that with the American football players over in the States. It's a thing that happens quite frequently. So a good acute dose of CBD, quite a high one, maybe 150 milligrams or so after a head knock would be good, but you have to make sure you haven't got any interacting pharmaceutical medications if you're going to use that sort of dosing of CBD. But generally, CBD will be good to reduce those histamine responses and inflammation throughout your body. And you'd want to use it regularly. And my starting dose, I suppose, for CBD is about 30 milligrams twice a day or 20 milligrams 3 times a day. So that's 60 milligrams a day. That's a good balance between cost and clinical effect, I find. So you would use at least a minimum of that, in my opinion, and you might want to have a little more than that if that's available to you for its anti-inflammatory effect. Yeah. Hope that answers your question.
Hi, Dr. John. It's Gerald here.
Oh, g'day, Gerald.
I'm really confused about the entourage effect and how it works.
Mm-hmm.
Is it THC that keys into the endocannabinoid system?
Yes.
And CBD doesn't?
CBD, there's
receptors.
There's two ways. There's two receptors. Like there's heaps of receptors, but the two main ones are CB1 and CB2. Don't worry about the one or the two. Cannabis receptors, right? THC is the one that binds into the receptor. It activates the receptor, stimulates the receptor, and it does that wherever they're being expressed. CBD has an affinity for both, but likes the CB2 a little more, and it doesn't bind here in the cleft. That's called orthosteric, or bone. You can't change bone, right? Orthosteric binding. CBD will actually bind allosterically, so that means it'll bind onto the side of the receptor, and it changes the way the receptor works. So in the case of CBD, it makes the fingers, especially of the CB2 receptor, stronger. So it can hold on to your anandamide or your THC for longer before it lets it go and it starts to get broken down. Another amazing thing of CBD is that it slows down the actual breakdown of anandamide, so our natural and main natural endocannabinoid. So it slows that breakdown, slows it down so it circulates longer. So I think I know where you're going with this, Gerald. So when you're talking about the entourage effect, how does it work? Well, there's many, many little effects of how it works. So THC is the main molecule that stimulates things, but certain terpenes and CBD and certain minor cannabinoids will also bind to the receptors in different spots and change how they work. So that will change how the intensity of the THC molecule stimulates the receptor. Some will make it stay there for longer, some will make it bind a little stronger. The entourage effect also works in a diffuse way, because I was just trying to explain, and I know this is a difficult concept to understand, but the cannabis system is really just everywhere. And where it pops up is where those particular cannabis receptors are stimulated. But not only that, we have a myriad of other minor cannabis receptors that are stimulated by CBD in particular, and when we're talking about the increase in serotonin being released by the 5-HT1A or serotonin receptors. So the way that those molecules work individually, and this includes terpenes as well and the minor cannabinoids, they may have different targets besides just the cannabis receptor. So you're going to get an increased response through those other systems while you're getting the direct response of THC. So if you just use THC alone, say, you're only going to stimulate the cannabis receptor. If you add in some CBD, well, that's going to affect how the THC will bind to the receptor. And then if you add in some terpenes, they may change the way that the inflammatory response occurs in case of beta-caryophyllene, or how certain parts of your brain respond in the case of linalool, which gives you that relaxation effect. So that's why whole plant medicine's better. Because it's not just that we're attacking it from different molecules. So we've got multiple molecules, hundreds of molecules having their own little physiological effect. But at the same time, and the interplay is intricate, and I'm not all 100% around it, it's very intricate. But the way that the presence of those other molecules affects how THC and anandamide bind to the receptor. So that's why we have the entourage effect, and I feel that the entourage effect is really what gives us the difference between black and white. It gives us all the shades of grey. Because there's a really interesting thing, and Kylie mentioned it before, that THC is a partial binder to the cannabis receptor, which is true. It binds with varying amounts of strength and connectivity, essentially. And they did a little, not a little study, they were trying to make money, pharmaceutical companies, and they invented a medication, I won't say its name, but it's a complete blocker or antagonist of the CB1 receptor, because the CB1 receptor is what's associated with appetite control and munchies and that sort of thing. So they thought, well, this would be a great appetite suppressant. Let's block that receptor. People will lose weight. We'll fix the global obesity epidemic. Everyone's going to be happy. And it started out okay. People were losing weight and they weren't having such an appetite, and it was getting a good physical response. But then the problem was they just noticed there was a lot of depression and anxiety in this group of patients. And then also a couple of people had suicidal ideation, and in fact a few people did suicide. So we lost lives. And that was because this synthetic THC molecule was so effective at binding to the receptor. It was 100% black, there was no shades of grey, and it actually turned off the, it caused depression and mental instability and death. So it's not a good idea to be all on or all off with cannabis, and the entourage is about modulating that and making it more than just THC or just CBD.
Thanks. I think we'll have one more question, and then we'll be on to who has got the microphone. This lady here, so you're the lucky last for now. No, give that to me, Gerald. Thank you. And I was going to say, seriously, I'm sure there's heaps of questions and people love to have conversations. So as John mentioned, Plantmed have got their own spot over further towards the Green Bank. So if you haven't explored the rest of Plantum Park and the rest of this event, then please head over that way and you'll meet Plantmed as well as Mullaways and a few other things over there as well. So yes, sorry, your question?
Good afternoon, I'm Vanessa. I'm just asking a question about just dementia and acquired brain injury, and just any research or side effects with using cannabinoid or whole plant medicine with psychiatrics and pain management in the ageing.
Okay, yeah, good. Another great question. Probably spend about 8 hours on that one. But yeah, the short answer is yes. Both THC and CBD have been shown to be neuroprotective, meaning they protect the brain against damage. CBD has been shown to reduce the amount of glutamate, which has been released in our brains, and glutamate toxicity is associated with Alzheimer's and dementia. So use of CBD and THC can slow down the progress of those diseases, and I've seen that in my clinical practice, sometimes turn back the clock a tiny bit. You're not going to get someone back to the way they were when they were 50, but quality of life can be easily improved. So generally with palliative or geriatric cannabis use, I keep things really simple. I use a pre-mixed medication normally, because they're not normally driving, of THC and CBD, about 5 to 10 milligrams 2 to 3 times a day. And that will help with sleep. It'll help with the aches and pains of just being old. It helps with the anxiety. It de-stresses the body. And as Kylie brought into it, maybe there's some association with how we transition into the next journey, whatever that journey may be, and it depends on your point of view. But that spiritual connection, perhaps it helps people settle a little with that. And I don't know, that's something that sometimes comes up, and I do have a chat with patients, and they do feel calmer about the impending close of their life, or however you want to look at it. Brain injury, once again, similar to the traumatic injury effect with CBD. We can use CBD as a neuroprotective acutely, but also chronically. So we use it regularly to reduce inflammation throughout our brain and body. And that reduction of inflammation will slow, as we've noticed with Kylie's talk, there's inflammation of the brain is associated with mental disease across the board, it seems. So schizophrenia, anxiety, depression, insomnia. We have increased inflammation in our brains. So if we can turn down that inflammation can be kind of like thought of as rust in your body. It's aging, it's damage. So we want to turn down that inflammation and that inflammatory response. So all those inflammatory mediators, the cytokines and things that get released when we have inflammation or a traumatic injury, they're turned down and we reduce the damage associated with that inflammation. So yeah, I think in terms of psychiatric use, generally very useful for a lot of psychiatric conditions. We should always take care of anyone with any psychotic symptoms. So if you have schizophrenia, or you've experienced a psychotic episode, or you've got a close family member who's schizophrenic, then we should really take care and probably leave out THC, at least initially, until things are very stabilised. And then even if it is introduced to help with another symptom, say, we should do it very slowly and very carefully. So yeah, I almost see CBD as just a supplement. I think it's amazing. It's also a medicine. So in that sort of sense, yeah, I think moderate use of CBD and THC in a kind of balanced ratio will work very well. And a little bit CBD extra is always good for anti-inflammatory effect. But one important thing to remember is that CBD in high dose can affect the way some of your other conventional medications are broken down by your liver. So if you are planning to use CBD in anything above, say, 60 to 80 milligrams a day, it'd be nice to check in with someone like myself and just make sure that those other medications, if you're taking them, are not going to interact and help guide you. So that must be my time out. Thanks very much, everybody.
Wow.
And please come and visit us at the Plantmed store.
Wow, thank you very much, John. That's totally MardiGrass, isn't it, that happening?
Thanks very much, everybody.
Wow.
And please come and visit us at the Plantmed store.
Wow, thank you very much, John. That's totally MardiGrass, isn't it, that happening?